Hi everyone, my name is Yulika,
My name is Kaye.
And I'm Harsh.
and we're recent graduates working with Dr. Arjuman Siddiqui as part of our Social Epidemiology Research Group. Today we got asked to talk about the Infectious Disease Working Group, or IDWG, which is a student-led initiative based out of the Dalalana School of Public Health, which we helped found at the beginning of 2020. So our group includes students and alumni from epidemiology, indigenous health, occupational and environmental health, and social and behavioral health sciences. And this all started at the beginning of 2020 when we created the group with the aim of educating the public and dispelling common myths around COVID-19. Along the way, we also picked up the aim of raising awareness and advocating for policy changes, as well as promoting health equity to help communities disproportionately affected by the pandemic. At the time, we were all second-year Master of Public Health students, and we identified a gap where early on in the year, there wasn't a lot of coverage on the pandemic. We believe that we have the knowledge and expertise from our graduate studies to aid in the COVID-19 response. As students in epidemiology, we found that we had a pretty good grasp in data sources and also data analysis, but we found this unique circumstance as a really great opportunity to grow and build upon our skills in our ability to synthesize, share, and also exchange factual and relevant information and resources on COVID-19. So as the pandemic evolved and disparities in outcomes and services became more apparent, we began to focus instead on providing resources to marginalized communities and advocating for social programs and public policy to address those disproportionate effects. And so since the beginning of January 2020, we've accomplished quite a bit, and some of those things include delivering successful webinar presentations to community organizations, organizing a panel discussion on mental health and its ramifications on because of COVID-19 in marginalized communities. We've also helped to launch the Give One, Get One mass campaign in coordination with healthcare professionals. And we've also grown our social media presence and have also written opinion editorials that are featured right now on various outlets. And so we have some on the U of T website, Dalalana website, Open Referral, as well as COVID Kindness. And finally, we've also created and launched the ReConnect tool, which is a web-based tool for locating and accessing resources and services in the Greater Toronto Area. And this will be the focus of our video today. And so I'm just going to pass it off to Kai now, who'll be touching a bit more on ReConnect and the motivation behind putting it together.
Yeah, thanks, Yulika. So what was the motivation for putting this tool together? Well, many of the members of our infectious disease working group were working at public and private organizations, as well as community-based agencies. And during a time of unprecedented physical distancing and rapidly evolving public health measures, individuals and communities we served expressed difficulty in navigating the resources and services available in the GTA. As the COVID-19 pandemic evolved, centralized access to resources was critical for the survival of many families and communities. So now that we have this understanding of a very clear problem communities are facing, what is the solution here, or what is something that we could do to kind of close that gap? So efforts from mutual aid groups were springing up to fill the gaps in our city's COVID-19 response. And as a team, we recognized almost immediately that these resources, alongside more formal programs and services, needed to be aggregated and made more accessible to those most vulnerable. At the time, which was around March, a centralized platform did not exist. So motivated by concerns voiced by local communities, we created a tool called ReConnect, as Yulika explained, which is an interactive web-based tool that allows users to locate available services and supports in their respective communities. So you're probably wondering, what data did we use and how did we even get it? So we linked up with Open Referral, which is a platform that develops open source tools on information about health and social services. And through Open Referral, we were able to access their Open 211 dataset. This data came from a partnership between Open Referral and 211. And for those of you that aren't familiar with 211 Ontario, they provide updated data information on public programs and social services. So we took that data and we curated it and we visualized it using our tool through ArcGIS. And a member of our team, Evelyn, was able to use this geographic and spatial mapping software to really visualize it and create our tool, ReConnect. So in our tool, resources are organized by service types like essentials, mental health, employment or training, childcare, and priority population groups. ReConnect also includes informal community resources that have undergone a careful screening process. We want to ensure that our tool reflects the amazing grassroots efforts springing up in communities. So, the ReConnect tool has been receiving attention, and like Yulika mentioned, multiple articles from the Alana and the main University of Toronto channels have posted it and other outlets, and the tool is now receiving hundreds of views every day, and it is hopefully filling the gap that we aim for it to, for it to serve. And we have received requests for collaboration to expand the tool to regions outside of Toronto, including Peel and York region. We also garnered attention from the House of Commons Standing Committee on Health, which Dr. Siddiqui is a part of, and we were able to write a policy brief to the committee on the ReConnect tool, also advocating, for policy changes we believe the federal government should enact or endorse to help the communities our tool aims to serve. So Harsh will now kind of speak to an analysis that we put together on the resource disparities in Toronto and the impacts that it's had.
Thanks, Kai. So as Kai said, after looking at the map, we kind of saw, doing some more spatial analysis and heat maps, we saw that most of the resources were aggregated closer to the city center and more available to these communities, as you can see from the darker shading of this area, while outer neighborhoods were more resource poor. And if we compare this to a map of COVID rates, this was from mid-June when they started releasing COVID rates based on neighborhoods in Toronto, we can see that the darker regions where there are higher access to resources or higher number of resources have fewer number of cases, or the case rates are much lower in these areas. So the people who are more likely to be impacted by the virus seem to have less access to the resources. And then if you continue with this, we wanted to look deeper in this analysis and see, what other socio-demographic factors were involved in this. We saw that the amount of resources that were allocated to Toronto was also kind of inversely related to the proportion of Black people in certain neighborhoods of Toronto. So if you look at this map, you can see that majority of Black folks who live in Toronto are located in the periphery of the city, where there are also fewer resources. Now, this follows a deeply concerning association that we found in the United States, but now it's also been kind of backed up here in Toronto, where Black, Indigenous, and other people of color have been disproportionately affected by COVID-19. So you can see this, this graph that was released by Public Health Toronto that shows that, Black, South Asian, Latino, Southeast Asian are disproportionately affected by COVID-19 based on the population that they take up in this city, versus if you look at the white population, they're severely underrepresented. They're severely less affected by COVID-19. And if you also look at by income level, you can see a steady trend where the more income you make, the less likely you are going to be affected by COVID-19. And we can all just kind of logically understand that the more income you make, more likely that you are able to work from home, the less likely you are to use public transit and expose yourself to people in in crowded areas. So, this just follows the trend that people who are most vulnerable, the most marginalized, are getting the most affected by COVID-19. And then we did some more analyses and looked at different socio-demographic factors. So we looked at median income. We saw that people who have less income are also aggregated on the outside in the periphery of Toronto, where the COVID rates are higher, and there's higher Black population. There's also more crowded housing. The education level is less. The unemployment is higher in these areas. There's less access to healthy foods. There's more chronic diseases such as diabetes and poor mental health in these areas. So it's no coincidence that under-resourced areas in Toronto and the most negatively affected social conditions, whether it's health or income or education, any socioeconomic status factor, they're also the hardest hit by COVID-19, and they are also they also house the highest number of Black, Indigenous, and people of color in the city. So these prevailing social conditions and inequitable distribution of resources that we found are just visible examples of the systemic racism that Black, Indigenous, and people of color experience on a consistent basis in our city. And the data and evidence that our team has gathered for Toronto illustrates the need for a coordinated government response to address the determinants of health and to protect the most vulnerable and marginalized in our society. So just to wrap it up, that's kind of the analysis that we did with ReConnect, something that we found and we were able to kind of move forward with. If you'd like to learn more about us or the ReConnect tool, you can visit us at idwg.ca, which is our website. And you can also keep an eye out for some applications to join the IDWG team. So we just transitioned over to a new executive team, and they'll likely be recruiting some general team members for their new team for the upcoming academic year. So yeah, if you want to become part of the team and apply your public health skills and knowledge that you learn in class in more of a real world application, please reach out to the team and apply. And yeah, I just want to say thank you on behalf of myself, Kai and Yuli, and thank you, Dr. Siddiqui.